Have you ever felt so backed up that you're considering grabbing an over-the-counter laxative? Or maybe you've already started down that road but wondering if it's really the best path. Is that quick fix really safe if you use it often? What's the difference between the bulk-forming, osmotic stimulant, and stool softening types? By the end of this video, you'll know exactly what to do if you want to go the laxative route. We'll talk about the science, the real-world risks and benefits, tips from doctors, and some natural alternatives as well. Let's kick things off by talking about what over-the-counter laxatives actually do. In a nutshell, laxatives are medications that make your bowel movements easier and more frequent. But before taking any laxative, it's essential to know that there are two main categories: over-the-counter, OTC, and prescription. Today, we'll focus on the ones you can find without a prescription. Here are the main types of laxatives available over the counter and how they work. First, bulk-forming laxatives. These work by adding bulk to your stool, helping it pass through your digestive system more easily. They absorb water and expand in your gut, making things down under, shall we say, softer. Examples include psyllium, methylcellulose, and chia seeds. Next, osmotic laxatives. These pull water into your intestines via osmosis. This softens the stool and makes it easier to pass. These stimulate the muscles in your intestines to contract, pushing everything along. These loosen the stool by interfering with the normal chemical processes that make your poop hard. Laxative is the most popular stool softener. While each type has its mechanism, it's also important to understand the speed of onset. Remember, this isn't a fast food menu where you order and expect instant delivery. Your body, your rules. It's all about understanding what works for you and how gently you want to go about it. Just remember, every product is unique, and what works for one person may not work for another. So when are over-the-counter laxatives a good idea? They're a great go-to for immediate relief from constipation. Life gets busy and sometimes things slow down under. When that happens, having an OTC laxative in your medicine cabinet can be a lifesaver. Maybe you're facing a looming deadline or have an event you can't afford to miss. Laxatives can help get things moving again. They can also lend a hand when your digestive system feels sluggish but hasn't quite backed up. After a big meal or during times of stress, an OTC laxative can be your secret weapon to keep things running smoothly. Remember, consistency is key. So even when life gets hectic, you can rely on these little helpers to keep your schedule on track. Firstly, they offer quick relief from occasional constipation, helping to alleviate that frustrating feeling of being backed up. Secondly, they can come in handy when dealing with the aftermath of certain medications. Many medications like painkillers and antidepressants can wreak havoc on your digestive system, leading to constipation. Here, laxatives can play the role of a supporting cast member, stepping in to keep things running smoothly. Additionally, laxatives can be beneficial during pregnancy, post-surgery, or when facing certain medical conditions. During pregnancy, women experience a myriad of bodily changes and hormonal shifts. While it's crucial to consult with your doctor first, laxatives can be a helpful tool in managing pregnancy-related constipation. Similarly, post-surgery patients often face temporary bouts of constipation due to changes in their diet and reduced mobility. And let's not forget about the role of laxatives in managing medical conditions like irritable bowel syndrome. Another advantage of OTC laxatives is their convenience and accessibility. No need to book appointments or wait for prescriptions. You can usually find them right in your medicine cabinet or down at your local drugstore. However, remember, while they're called over-the-counter for a reason, it doesn't mean you should use them without a bit of knowledge and caution. So always read the label, understand the risks, and use them responsibly. And remember, nature's way of keeping things moving is usually the best way. So try increasing your fiber intake and staying hydrated before reaching for the laxatives. But now, let us flip the script and talk about the downsides and potential risks associated with over-the-counter laxatives. When you use laxatives regularly, your body can become accustomed to them, making it harder to have a natural bowel movement without them. Think of it like your body's alarm clock. When you use laxatives consistently, it can throw off the internal rhythm that naturally regulates your bowel movements. So if you're not careful, you might find yourself in a situation where you need laxatives just to go to the bathroom. That's not exactly the kind of dependence you want. Next, overuse of laxatives, particularly stimulants, can lead to dehydration and electrolyte imbalance. Let's break this down a bit. Our bodies rely on a delicate balance of electrolytes such as potassium, magnesium, and sodium to keep things functioning smoothly. Laxatives work by speeding up the process of digestion and helping you have bowel movements. But when they become a regular habit, especially with stimulant laxatives, they can start messing with this electrolyte balance. And here's why that's a problem. Electrolytes play a bunch of important roles in our bodies, like helping with muscle function, nerve signaling, and maintaining proper hydration. When you lose these essential minerals because of frequent laxative use, it can throw your body off balance. Dehydration is another concern, especially with stimulant laxatives. When you're having loose stools frequently, it can lead to dehydration. Staying hydrated is super important because water helps keep our bodies functioning properly. And that's not all. Overuse of stimulant laxatives can also cause stomach cramping, and in extreme cases, even damage to the colon. It's like pushing a tired worker too hard. At some point, the body just needs a break. Now, let's talk about osmotic laxatives. While generally considered safe, using them for a long time can lead to a dependence on them. Plus, it can mess with your electrolyte levels, particularly magnesium. When you take osmotic laxatives regularly, your body can get used to them. And here's the kicker. When you stop taking them, your bowel movements can slow right back down to their previous sluggish pace. And what about bulk-forming laxatives? As helpful as they are, taking them without enough water can lead to stomach discomfort and even infection. Imagine trying to push a giant ball of yarn through a tiny pipe. Not exactly comfortable, right? Also, stool softeners, despite their name, may not always work and can sometimes cause diarrhea. So you got to be careful. And let's not forget about interactions. Laxatives can interact with certain medications or be dangerous for people with specific medical conditions. For instance, if you've got kidney disease or heart problems, some laxatives might not be the best choice for you. Using laxatives can also mask underlying conditions that need attention, like colon cancer or inflammatory bowel disease. It's like trying to cover up a small leak in an old pipe. You might think you're fixing a problem, but you're just hiding it. And that's something you definitely don't want to do when it comes to your health. Now, it's crucial to be aware of the signs to watch out for when using laxatives. Firstly, if you've been using a stimulant laxative for several days and haven't had a bowel movement, it's time to reevaluate. Your body needs a break and some gentle coaxing to get things moving again. Another red flag is blood in your stool. While it's not always serious, it's a sign that you should check in with your doctor to rule out any potential issues. And if you're experiencing severe abdominal pain, swelling, or an inability to eat or drink, it's time to seek medical help. These could be signs of a more serious problem that needs attention. So when should you consider talking to your healthcare provider about laxatives? Well, if you're facing persistent or chronic constipation, it's time to reach out. Your doctor can help unravel the root causes and guide you towards the right solution. Additionally, if you're dealing with a medical condition like irritable bowel disease, Crohn's disease, or ulcerative colitis, seeking professional advice is essential. These conditions require specialized care, and your doctor can help you navigate the best course of action. And remember, open communication is key. Don't hesitate to discuss your symptoms, concerns, and the laxatives you've tried with your healthcare provider. They're there to help you find the right solution. So don't suffer in silence. Reach out for support and guidance. Your gut will thank you for it. Let's recap the key points about laxatives. First, always read and follow the instructions on the packaging. Laxatives are not a one-size-fits-all solution, and different products work in different ways. So do your research or ask your healthcare provider to find the right laxative for your needs. Second, use laxatives only for a short period unless advised otherwise by your healthcare provider. When laxatives become a long-term habit, they can start affecting your natural bowel movement rhythm and potentially causing dependency. Third, stay hydrated. Drink plenty of water throughout the day. This is especially important when using laxatives that can cause dehydration or change your bowel movement frequency. And fourth, pick the right type of laxative based on your needs. If you need fast relief, consider a stimulant laxative. For a gentler approach to regularity, opt for bulk forming or osmotic laxative. Eating a diet rich in fiber, staying active and listening to your body's signals can go a long way. Your body's a complex machine, and treating it well is key. So listen to what it's telling you and make informed choices. Whether you decide to use laxatives or explore natural remedies, your gut health is worth the effort. Comment below. What type of laxative have you used? What worked for you? Check out these related videos.